Okay, and then I'll just turn over to Heidi, and Heidi, you can do your thing.
Okay, great. I'm going to share my screen real quick. So let's see, there we go. So just welcome, and my name is Heidi Hotvedt, and I'm the Childcare Nurse Consultant, Healthy Childcare Iowa Coordinator for the Iowa Department of Public Health. I'm actually at home too. We're still working remotely from IDPH. I'm not sure when that'll change for Des Moines, but I travel a lot for my job. I actually live in Maquoketa, Iowa, so I'm not that far south of many of you in Dubuque. And I do have my contact information listed here, and my my phone number. So, and then also the Healthy Childcare Iowa website. So just wanted to share my contact information with you to kind of get started. And I'm going to just kind of go through my slides and just highlight some of the changes that have come up. And then if you have questions, I'm thinking you could probably, since it's a small group, you could just unmute and ask them, or you can put them in the chat box, whatever works best. Okay. So kind of the first thing I just wanted to let you know is the childcare guidance, the guidance document from Department of Human Services and Iowa Department of Public Health was recently updated September 30th and was sent out as a constant contact last week. So hopefully everyone has seen that, but I do know sometimes, you know, constant contacts come out and sometimes they get missed or go into a spam folder. So I just wanted to make sure that everybody was aware that that guidance document, as well as our outbreak reporting guidance document, has been updated and was sent out and posted on the DHS website, as well as the Healthy Childcare Iowa website. So one thing I just want to cover is there's some additional information about face covering and face shields. And we get this question a lot, so this was updated. So face coverings are encouraged for staff and school-aged children. Face covers actually are encouraged as a national push, as well as an Iowa push for an added layer of protection. And so if you haven't started doing face coverings in your childcare home environment, I would encourage you to start to think about doing that. The challenge comes with mixed age groups, of course, that for children that are under the age of 2, they shouldn't be wearing face coverings. That's a safety issue. So it's challenging, I know, for mixed age groups, you know, in terms of wearing face coverings and not having face coverings. But you know, now that most of our school-age children are wearing them, or required to wear them in school, you know, I'd say that most children, you know, when you're out and about, you go to the grocery store and you see children out and about, I think children are getting really pretty confident wearing face coverings, you know, and understanding the importance of them. I was actually observing at a childcare program a couple weeks ago, and you know, interesting to kind of see that, you know, the children had their face coverings on, and there was you know, a couple children that had taken theirs off. They were playing outside, so I mean, it's always a challenge, but I would encourage the use of face coverings if you haven't started that. And the Iowa Department of Public Health has some great links on their website specifically around face coverings, you know, how to store them, you know, washing them, how to make them, you know, everything, how they should fit. And they have some great resources available on the website, and that's actually linked from our Healthy Childcare Iowa website. So, and then of course, I always say, you know, contact your local nurse consultant if you have specific questions about face coverings and you need some guidance around health and safety for your policies, because they're department available for you with, you know, for you to ask questions and kind of get that guidance. In terms of face shields, Department of Human Services and IDPH childcare guidance is following the CDC guidance that says that when you're wearing a face shield, that a cloth face covering should also be worn. And I know that's been a question we've had, and I think for a lot of individuals, you know, they think, well, I'm going to go ahead and wear a face shield, but I'd rather not have a face covering on. And our guidance is that really that both should be worn if you're going to be using a face shield. Keeping group static, which this isn't really a challenge for home providers because you're so good at keeping group static, but I would say that, you know, if you're a larger program, a category C, you might think about, is there a way to kind of separate your groups a little bit by age? If there's two of you, that maybe the infant toddler ages that aren't able to wear the face coverings could possibly be in one group, or maybe the older children in one group. And so if there's any way that you can kind of divide your time somewhat between those groups, so that if there was a positive COVID case of like a child, then if it was in the older group and everyone had face coverings on, and your group has been static, and you as a provider have not mixed between the groups, there may be an opportunity that that you wouldn't be counted as a close contact. And so close contacts are probably one of the questions we get the most about when it comes to when there's a positive case. And even one of the questions here was about, I don't know what I'm supposed to do when there's a situation. So I do want to cover that, and I'll show you this little handout that's been added to our childcare guidance. There's a link on the guidance document, but it's also on our IDPH website and our Healthy Childcare Iowa website. Just wanted to let you know, we are still saying symptomatic staff and children should get tested if they are symptomatic. And the reason for that is we really want to make sure that we would like to not have to quarantine children if they're showing symptoms and it ends up that they don't have COVID, but they have maybe strep, so we don't need to then worry about quarantining the whole group. Now we have a diagnosis of strep. We know it's not COVID because it's a negative test. And so we can, proceed as we plan, and as we usually follow the guidance document, like with, for example, our normal, strep guidance would be, 24 hours fever-free without the use of medications. And then also, that they would be on antibiotics and have been on antibiotics for 24 hours before returning. So I think that's why we really feel that if you're symptomatic with COVID symptoms and even mild symptoms, that you should get tested. For children over the age of 1 and older and adults, the www.testiowa site will allow you to do an application or fill out a form to be able to get a test site for free testing. And that is available. You're listed actually as a priority group. Childcare staff and children in care are listed as a priority. So I know I've heard some different feedback a little bit that some physicians aren't wanting to test, and it is a parent's right to ask for a test if they're concerned about that, and they can explain that that would allow them to return to care sooner than waiting for the normal what we call isolation amount of time of 10 days. So I just wanted to cover that a little bit with you. I think, just really thinking about how do I mitigate the risk, really, and I'd say the first thing, and we've done really a good job in Iowa doing this, and I would say all of you are the reason that we have done so well in Iowa, is because you have really embraced the mitigation strategies that we have put out and have put them into practice, and have been health monitoring children. So if it's feasible, continue to health monitor with doing temperature checks. And then also by having kids stay home when they're ill. If parents are at home ill with COVID symptoms, even if they're, haven't been tested, or maybe if they're waiting for a test, parents should be home and the kids should be home with them, so that there's not a potential that there's an exposure then in your facility. So you're doing a great job with all of those mitigation strategies, and I would just encourage you to continue to be vigilant with that. And I know that's challenging because it's getting old. We keep hoping that things will change soon, but we will be going into flu season, influenza season. And I think just keeping those mitigation strategies of health monitoring, keeping kids out of care when they're ill, using face coverings, washing hands, all of those things are going to help keep kids healthy and in care. Any questions just specifically about that childcare guidance? If you had seen that, you could just either unmute and ask your question, or you could put in the chat box.
This is Mary Bertine.
Oh, hi, Mary.
Hi. I have a couple kids that come prior to going to school. First and third graders, should they have a mask on when they're here before they go to school? They come and get dressed and have a little breakfast and then they get picked up.
I would recommend that, of course, when they're eating, they can't wear a mask. And if you could have them, not sit together and set apart by 6 feet while they have their mask off, that would be best practice, and wearing their mask then while they're in care, because we do know that we've had an increased number of cases now that school has been in. So there is a bigger risk, I think, once kids are in the school setting, that there is a risk that they could have an exposure. So that would be my recommendation, is if feasible, to have them wear their face covering when they come in. And then of course, when they sit down to eat, to see if you can space them apart. And
okay, I'll give that a try, because they're cousins and they're pretty physical with each other, and close and all that. And it's just really hard to keep them all separated.
Yeah, I'm sure. And the thing is too, I know at school, they're trying to keep those groups separate, so the third grade group isn't mixing with the, sixth graders, or, but, when they're in group care, it's just so hard to separate that way. That's why I think having the added protection of a face covering can help, because we know that social distancing doesn't always happen. So good question.
Right.
Any other questions, Mary?
Thank you.
Okay, I don't see any other ones. So I'll just keep moving with slides. So the next thing I just wanted to point out is the case reporting and outbreak guidance. That's a combined DHS IDPH guidance document, was updated September 30th. That also was sent out in that constant contact, and you can find that on the DHS website, as well as a link from ours and from CCR&R. The guidance document really, the biggest changes was that guidance document. It's still the confirmed, we only case report when there's a confirmed positive. So if there isn't a positive yet, COVID, even if they have symptoms or maybe a family member is positive at home, we do wait for the reporting to DHS consultant and to your local nurse consultant and local public health is when you have an actual positive confirmed case. Or if there's 3 or more of separate, if they're not of the same household, then that actually is kind of reported to me, and then I'll track it, because we're looking at those outbreaks. We haven't had a lot of outbreaks, I will tell you. I think in homes, I've only tracked 2 since June. So we haven't had the outbreaks in homes, which is great. We've had some single cases here and there, but you guys are doing a great job with your infectious control measures. So for reporting, always make sure that when you get that positive confirmed, mom, our parent calls you, dad calls you and says, I just found out that my little one has a positive test result, then you'll want to reach out to your DHS consultant as soon as possible. And I know on the weekends, they're not available, but definitely by Monday morning, you want to be reaching out for that. Now, most of our nurse consultants also are not available. We don't have weekend coverage or evening coverage. I know some of us do answer our phones when we get those calls. So sometimes that happens. I've gotten some of those on Sunday nights. But just so you know, we are available, starting at 8 in the morning during the week. And then the other option too is to call the 211 number. That 211 number is still active. And so you can call the Iowa Department of Public Health 211 and get some basic information. And then you'll need to follow up with DHS then and your local nurse consultant or myself in the morning. So wanted to let you know about that. The close contacts need to quarantine for 14 days or longer. And so you'll identify who your close contacts are. And then I'm going to just share with you kind of this document that has come out, and it's when to quarantine. It's the IDPH guidance document that has come out. And I'm actually going to pull it. Up because I think it'll be easier. So I'm going to just shut this down for just a minute. Does anybody have a question on this slide so far? Okay. So think, are you guys all seeing the document? Can you see that? Oh, no, okay. I'm gonna stop share and then pull it up again, okay? Sorry about that. Okay, hopefully now you can see the when to quarantine document. Can you see it? Okay, good. I'm getting nods. That's good. So I tried to enlarge it when I was doing this presentation earlier today, and I think this is maybe a better way to show this screen. So this is a guidance document that was specifically created by Iowa Department of Public Health. It's an infographic that kind of gives some scenarios about close contacts. And it's for businesses, it's for schools, it's for education and childcare setting. And it's really meant to help walk you through those close contact identification. And then what do you need to do when you identify close contacts? You know, do they need to quarantine? So kind of looking at isolation and quarantine and close contact information. So I'll just kind of go through the scenarios with you. So when everyone is masked, okay, so when you think about this, so you have one positive COVID person and they have a mask on. So let's think about that school-age child that's worn their mask in care, and they've stayed, when they haven't had their mask on, they have stayed 6 feet away from other children. So they had their mask on, and then everybody else in the childcare, you know, possibly they were all over the age of the 2, everybody wore their mask the whole time. And so even though you've had this positive case that they're needing to isolate for 10 days, the rest of the, what we'd call close contacts, they're all masked. They're going to self-monitor to see if possibly they had an exposure, but they do not need to quarantine. So they're not having to quarantine out of care for that 14 days because they were all wearing masks, and the person that is positive was also wearing their mask. Now, this is sometimes the situation that we run into. Actually, I'm going to share this one. Some close contacts were masked. So in group care, you know, you have maybe your infants and toddlers didn't have their masks on. You had your mask on, and you wear your mask. And then you have some children in care that wear their masks. And then you have a child that is COVID positive. So same scenario, you have a school-age child that wears their mask. They're there in the morning. They had their mask on. The other kids in care had their mask on. But of course, our infants and children that were under the age of 2 did not have a mask. So the infants and toddlers would need to quarantine for 14 days because they didn't have a mask on and had a potential exposure. The children and yourself who had your mask on, you would self-monitor and just make sure, but you wouldn't need to quarantine, which is really, you know, helpful for programs to not have to, you know, either close down or have a whole group of children quarantine. And then, of course, the person who was COVID positive, even though they had a mask on, they will still isolate for the 10 days. The other scenario, a couple other scenarios is, you know, if no one's masked, then all the close contacts need to quarantine. The isolation, the person that has COVID positive, of course, they would be quarantine or isolating for those 10 days. We get that question a lot about, you know, what about, I mean, these are the scenarios that I've gotten is, well, how about like my own family members? So, you know, my own family, you know, they were around my childcare program. They were within 6 feet. We were maybe all sitting at the table together having snack. And so now, you know, are they considered close contacts? And you know, unfortunately, yes, they are. And so that's where I really think that as a provider, really thinking out, you know, how can I safeguard my own family by keeping them distanced from the childcare group, or if they're not able to keep that 6 feet distance, that they have their mask on, because that's where you're going to really help with that. Of course, we know that during meals, and this is the challenge, during meals and nap time, they shouldn't be wearing their mask. They can't wear their mask when they're eating, and that's usually 2 or 3 times a day or more, depending on how long your program is and how many hours the child is there. And so that's where, if they're having their mask on, then it's really not, it's going to kind of defeat the purpose, because they need to be wearing their mask or 6 feet away from other children and you. And so in a home setting that, and actually even in childcare centers, this is really challenging because 6 feet is a long way. And how do you sit people at a table and they're all 6 feet away? But I've heard of some really good ideas, and I don't know if anybody wants to share any ideas that they've had by trying to socially distance, you know, how they've done that. But I heard the other day that they put 2 tables out and they're doing them at the ends of the tables and they're spreading them out. I heard of one provider that was actually kind of setting each kid separately with kind of a TV tray kind of situation, trying to keep that 6-foot distance when they had their mask off. I'd say in centers, we're seeing a lot more masks being worn in centers probably than homes, but so just some things for you to think about is how you could possibly you know, limit that exposure. And maybe it's not limiting exposure with that. You know, that's another thing is to think about when you have that before and after school age kids that are maybe at a higher risk coming back in and they're going to eat lunch, have snack. Maybe they shouldn't be having snack with the whole group because they have their mask off. So that's just a way just to kind of help with that mitigation strategy. Because then if that school ager does have an exposure and test positive, then you're going to need to identify your close contacts. Well, if you had them sitting by, you know, themselves, maybe two or 3 kids, and they're sitting at a big table and they're 6 feet away from each other, or you're having them sit, you know, at different tables 6 feet away when they have their mask off for snack in the afternoon, you know, and the other times they had their mask on the whole time and you had your mask on when you're around them or you were 6 feet away, then the local public health and the nurse consultant, when they're working through that, who do you need to quarantine and the close contacts, they would not be counted as a close contact. And we've actually had that scenario already since we've had this guidance document come up. I had 2 calls today specifically around identifying the close contacts, and the ones that had masks on were not counted in the close contact group. Really helps to safeguard keeping programs open. I think I just see a couple chats here, so just gonna look here.
I did
so
put in the
know-
link, Heidi, for what
I
you
see
just
that.
shared. And then I can
Great.
also, if you want me to pop the link in of the one that you had referenced for figuring out that timeline, the calendar, I can do that as
that'd be
well.
great. Yeah, you can put that in there too. Let's see, if a child or parent in my care tests positive, am I required to close down for 14 days? And that's where it's really not a requirement to close down. It's just identifying those close contacts. That's the challenge. That's why we go back to, you know, who was that child involved with? Now, if the parent tests positive, the child themselves is quarantined, but that does not necessarily mean that you need to quarantine everybody in your care unless the parent was in close contact with others in your care. Now, if the child tests positive, then that's when you're going to be saying who were the close contacts with that child. And it possibly is you. And if it is, then, you know, chances are you're going to have to close down because you're going to be in quarantine for 14 days. I have had I had a scenario that came up where it was a category C. So there was 2 providers. The one provider was quarantined. The other provider was not there the day the child was there. It was like the Friday, you know, where the exposure occurred. And so they were able, because of the setup of their childcare program, the provider, you know, was going to stay upstairs. The co-provider was going to work. They have a kind of a walkout kind of situation in the basement. And so she was going to be able to provide care to the group that wasn't exposed. So they actually, as co-providers, have kind of a separation between their kids. They've been doing that with COVID. So that worked out for them. And so it did not impact the whole program. Fortunately, I think they ended up with, I know one provider, and I think it was 6 children that did not have to quarantine. So that's where they had some ability to keep their doors open, which was good. So I think, and good for those families and good for the provider. Not good that you have to quarantine for 14 days, but at least it was an option that they walked through. And that was one that that actually I took the call on that one because there was some questions and trying to figure that out. I don't see any other chats just yet. So unless somebody wants to unmute and ask a question, I'm going to go back to my PowerPoint.
Heidi, I do have a question for you that when you were talking about the masks and isolating now, when you get those calls, is there ever a question, like if you have a child, let's say, who is not super great at their mask on, is that ever in conversation
Yeah,
with
and that's
that
the thing,
masking question?
they need to be having their mask on and not, having it off and on and that kind of stuff. We do know, like I said, we have times when they're going to be without a mask. The guidelines is a close contact is identified as within 6 feet for 15 minutes. So if you had a child that had taken their mask off, you had your mask off and you had to readjust it, and that was the only time, there wasn't a 15-minute period of time that you had an exposure, then, local public health would look at that. And I would believe my thoughts would be that they would say no, that person, you wouldn't be considered a close contact because you just adjusted their mask and you had your mask on while you did that. And but we do have kids that are just, it's constant, and then that would be more challenging. So it's a learning process for everybody, for sure. I'm going to go ahead and share my screen back to my PowerPoint here. And we'll just kind of keep working on here. So for kind of just that isolation guidance, I know this question has come up a lot, but if a child or staff person has COVID-19 and or has tested positive for COVID-19, then DHS is following the CDC isolation rule that you can be back in care after 10 days since the symptoms first appeared, and the child or the adult needs to be 24 hours fever-free without fever-reducing medication, and the symptoms have improved. So that is a challenge. What I hear a lot is, why is it that the person who actually has COVID is only 10 days, but the quarantine's for 14? And that's because it's the disease process. Once you actually are testing positive for COVID, you've been shedding that virus prior to those, possibly for a couple days prior to the actual test being done or to being tested positive. So they're done through their infectious disease shedding of the viral shedding by after that 10 days have passed, where the guidance for quarantine for 14 days is because if you're exposed, it might take a couple days before you would actually, up to 14 days, to actually start showing symptoms or possibly tested positive. It's a process of having it in your system before you would actually develop the illness. So after that exposure, you would need to quarantine for 14 days, because that's after the 14th day, then day 15, you would be cleared and the virus would not have been shedding, where you would have been able to actually expose someone else or have the symptoms and start testing positive after that date, because of the process of the disease process. So 14 days is a long time to quarantine. Isolation for 10 days is a long time. I will tell you that that's the reason we go back to let's get tested. If we have testing done and say the child has a small, slight fever, a sore throat, a couple symptoms of the COVID-19 on the symptoms list, they go in, they get tested, they test negative. Then because they had symptoms and tested negative, then they do not need to wait the 10 days. They can actually return to care 24 hours fever-free without fever-reducing medication. And then also that they, whatever criteria that the actual disease, so if they've diagnosed them with maybe strep, and they have to be on antibiotics 24 hours, of course, before they would return. So it does shorten that isolation rule. And that's why we're just encouraging testing, so that we can rule out that that it's not COVID and it's something else. And this is going to become really important, even with running into flu season. I actually talked with a parent, and they had some concerns about testing, and they said, I just don't want my child to have to go through that. And I just reminded them that really at this time of the year, it's very common, if your child goes in for any kind of illness, that is anything related to strep or to influenza, that a child would get tested for those. That's, they do a throat swab or they do a nasal swab for influenza, and that is not an uncommon occurrence. And so we need to think about that for COVID-19 the same way, that testing allows the provider, the child or the healthcare provider, to actually diagnose what the illness is for that child. And then we would be excluding them based on that illness. I'm gonna just keep kind of going on. We just covered this fact sheet, and like I said, it's on the Iowa Department of Public Health, and then we did a direct link from the Healthy Childcare Iowa website, as well as I know you just put that in the chat, so that was great. And then the next, I just wanted to show what our Healthy Childcare Iowa website looks like. So when you go on the Healthy Childcare Iowa website, you'll see all the tabs here on the side. The Childcare Nurse Consultant tab is where you would see our map and our contact information for all our nurses across the state. We have childcare nurse consultants locally in all 99 counties. And for those, we actually have a couple vacancies, and one actually is in your area. So Darla Budekoffer, and tomorrow would be her last day. And so we will have a vacancy. I know they're going to be hiring for that area, but I'm here to help. So, and I know Kim Gonzalez is on the line too, and she also helps with our TA team on Mondays. So we are here to help you, as well as Deb Geimer. So we're all listed on our on that Healthy Childcare Iowa map in the contact area. So if you can't get a hold of somebody, call me. Just you want to get reach out to your CCR&R. They might direct you to who to call. So just know that we're here to help you and be available when there's questions. And then if you go down to the printed products tab and you click on that, you'll see this pop up, and it's the printed products section. And there's a lot of fact sheets and helpful information, but that's where our COVID resources are at, and that's where we have some direct links. It's somewhat challenging to go to the CDC website and find specific things for childcare. IDPH has, they've done a great job with a lot of postings on their website, but it's a little overwhelming when you're trying to find something specific. So we just post the specific links and locations on this section, so it kind of keeps you up to date. And then another resource that I wanted to just share is the symptoms chart. And because we're running into, influenza season, we have a lot of colds, seasonal allergies this time of year, asthma exacerbation because of, there's a lot of dust and mold during harvest. So really, this is a great chart. You might want to print it out. There's English and Spanish versions, and you can print that out and post it or give it to your parents. But it's a great little symptoms chart, and would be helpful when you're trying to evaluate symptoms. I will say, going back to what we said in the beginning, is if a child is ill, they need to stay home, and getting tested is a way to determine what they have. But the question I get a lot about is runny nose, seasonal allergies, asthma. I mean, most kids with asthma, they do cough. Most kids with seasonal allergies, they do have runny noses. And so that's where, go back to really what is the norm for that child. If it's normal for the child to have a runny nose this time of year, and you know that, or it's documented in their health record, and I think that's a good thing to document, then that's kind of the normal for this child, and they're not actually ill, they're just having some allergies. Same thing, with asthma, we know that, kids that have an asthma exacerbation, you want to have that documented on their asthma action plan. And if you don't have an asthma action plan for the child, work with your local nurse consultant or with me to get that put into place, so we can work with the healthcare provider and make sure we have the correct information for that child. So we know that's their normal, and that's not that they're ill with COVID symptoms. So this is a helpful chart. I did see a couple chats pop up here. I'm just going to look at those.
It was probably me. Sorry.
Oh, was it you? Okay. No additional questions.
Just putting in those links.
Yeah, that's good. But this just goes through some of the symptoms, and all of the COVID symptoms mimic so many other of our health situations that children are kind of our normal health things. But we have had, and this is the challenge, we have had children in Iowa in care that were diagnosed with an ear infection and put on antibiotics, and then also they found out the child had COVID. I actually know of one case where the child returned to care because 24 hours after antibiotics, they returned to care, but forgot to mention that the doctor's office also had run a COVID test. So they were in care while their pending results their results were pending. and mom had not mentioned that. And then of course it was positive, and then all of the children then were exposed. Of course, it was an infant toddler room, so it was a younger age group. No one had masks on, and so then the whole group was out for 14 days. Very challenging. So that's another thing to remind your parents, you know, if they're going in for, if they have an illness and they're going in for, you know, being seen by the doctor for like an ear infection, or they think it's, you know, they think it's croup, or they think it's, you know, a sore throat, and they think maybe they have a strep. You know, make sure that if they have a pending COVID test, that's what we would recommend. Don't have them return to care until they have that test result in place, so you know for sure. Let's see, the next thing I just wanted to share, this is actually kind of just been updated, and just wanted to share this. We have struggled with the EPA has a environmental protection agencies who registers all our disinfectants that are in use, and they had a list for effective disinfectants against COVID-19, and the website was really challenging to use. So they actually have a new website, a new search tool on their website. So you can actually browse by the EPA number, of course, but even the product name, the ingredient, which is great. I had a provider that wanted to find something that had, they didn't want bleach, they didn't want to use bleach, and they were looking for some other peroxide-based cleaners or disinfectants that they wanted to see if it was effective against COVID. So went through and actually put in the ingredient list, and then they were able to pull up the products that were covered against COVID, so they could choose which one worked best. And there's even a search by contact dwell time, which I just had a call yesterday about a product that was 10-minute dwell time, and the provider was trying to find something that was quicker, because 10 minutes is a long time to wait for something to be in contact with the surface. And so I said, well, if you haven't seen this new tool, it's really great. You could look for something that has a shorter dwell time. So that's the link for that. And that's something too, you know, our local nurse consultants, I mean, I would say we have become the experts on disinfectants and cleaning and sanitizing. So we are, I mean, we're so used to using the EPI website, we can look up anything pretty much quite quickly, or we maybe already have looked it up a dozen times and we have it saved. So, you know, reach out if you're looking for a product and trying to figure it out. I know a lot of programs are using bleach, but you know, bleach is just so hard because it bleaches everything out. And no matter what setting, whether it's also an asthmagen, so it's an irritant to the respiratory tract for children and adults, but you know, it just bleaches everything out. And in the home setting, that is just so frustrating when it's your own home environment and you're getting bleach spots either on the floor or on your own clothes, or, you know, soft surfaces. So I know that a lot of programs are trying to find other products other than bleach if they can. Here's just wanted to show our map again. And then, like I said, there's the direct link to our consultant. So this is kind of this lighter green area, not including Dubuque, but our north area is Darla Butekoffer's previous area. So we're going to miss her. She's always been such a champion and such a great asset to our area. But we're excited for her. She's taking a new position. That's really exciting for her. So we're excited for her, and we'll miss her greatly. But just so you know, we will, I know that the agency is looking to fill that position. So hopefully soon. And that's all I had. So if there was any more questions or anybody wanted to unmute and ask anything about the stuff that I just presented on, or if any of the nurse consultants on here, if there's something I forgot or should have mentioned, chime in.
I am not seeing anything more. How about you, SD? No. Okay.
One thing I did forget to just chat about real quick. I know that some of the schools, the Department of Education, I didn't mention this before, they did have a handout that came out that was for Department of Education, and Iowa Department of Public Health had approved the evaluating 6 students and staff, and it kind of goes through some like lower risk symptoms and higher risk symptoms when it comes to COVID. And so that's been a question that's come up, is can programs that are regulated under Department of Human Services use this chart, and unfortunately we can't. We know DHS is aware that this does not align with, we would like to be, perfectly aligned with Department of Education, but we know that, childcare is a different environment than the school setting, and schools do have a lot more opportunities for, they have a school nurse on staff for evaluating ill students. They have a little bit more ability to socially distance at 6 feet away. They can really, enforce the mask wearing and for those older kids and staff. So that evaluation form, or what they would call is kind of a infographic or a decision tree, is not something that we're using for DHS programs at this time. And that's all I had.
Okay. Well, once again, thank you so much, Heidi, for all the information. I'm hoping that, if people have questions that arise, that they reach out to their nurse consultant, and if they're not positive who that is, they can definitely reach out to their CCR&R consultant, and we can get them in touch with someone or get them in touch with Heidi. Just to let you know, as I was sitting here, I got a phone call from a center that had a positive, and so Kim Gonzalez is probably still on the phone with that person. So I mean, it just, our nurse consultants really are a valuable piece of this puzzle. So we really appreciate you, Heidi, giving us this time.
Thank you so much. And I just appreciate all of our teamwork approach. I mean, I really feel like this is what has worked so well for our state, with our teamwork approach, working with Department of Human Services, IDPH, and our CCR&R agencies. And then really it's the providers. It's really the that you all have put into action the guidance that we've provided. And I know it's been hard. It's not easy guidance. It's challenging to change your program around and do things differently. But we appreciate it because we have been successful in our state to not have a lot. I mean, I think total, I've been tracking outbreaks since June, the end of June, and we've had, I think I'm at 26. And I think 2 of those were home. So not a lot when you think about, the number of childcare programs across the state. So that's really a blessing for our state, and really because of providers. You've all done such a great job. So thanks a lot. Hope you have a good night.
Thank you. Have a good night, everyone.
Bye-bye.
Bye.